Started now. I see that we have 28 participants who have just joined us. Once again, good morning, good afternoon, good evening, depending on where you are. And welcome once again to the Africa Internet Resilience webinar series. And this is the series number 7. And the series is organized and convened by the African Union Commission, Internet Society, and Huawei. This year, following the COVID-19 pandemic, we decided to keep on engaging our community, and we still deliberate on important issues to do with the internet, the digital economy, and connectivity and access. And we decided to take these discussions online, and this is the reason why we have this African Internet Resilient series. We have had 6 sessions so far from around March this year, and today we are going to have the 7th session of the webinar series. The purpose really for this webinar series is to assess the Africa Internet readiness to such events as COVID-19. And I think this particular event today is quite relevant and very important for us to reflect on what we have done and also what we can do and where we can improve. I think it gives us an opportunity to reflect on lessons that we have learned, the challenges that we currently have, and some of the successes that we have had in terms of managing this pandemic. So this particular session is going to discuss how Africa can build on the digital revolution in the healthcare sector, deliver solutions to fight against COVID-19. It will also strive to identify healthcare problems that can be solved by internet-based solutions. So I think this is going to be an exciting session that is quite relevant for our continent and for our communities as we fight the COVID-19. Today I'm joined by a very respectable panel that includes colleagues from the African Union Commission, from Africa CDT, Huawei technology, and also our colleagues will share some experiences from China. So I think you will find today's session quite interesting, and please you have an opportunity to also contribute to this discussion. We have a question and answer tab, and we also do have interpretation in both English and French. So to get us started, I think what I will do is first invite my colleague Moctar Yedaly, the head of Information Society with the African Union Commission, to open this discussion, to give us some opening remarks, and then we can get straight into the discussion for today. Over to you, Moctar.
Thank you, Verengai, and I hope you are hearing me very well, and if so, say copy. Okay, thank you very much, and it is my honor and privilege to be here today with you. And as you say, this is our 7th webinars, and we hope we will continue until the end of the year to do more. One of the major reasons we have done that is to continue to promote the power of ICTs during this pandemic, really, and to see from all point of view how resilient our networks in Africa in order to support the different activities and our business continuity, given the fact that we are limited now with movements and physical meetings and so on. The African Union Commission has, in collaboration with the Africa CDT, and in collaboration with many other institutions, and specifically within the commissions, more specifically within the department in charge of social affairs, have laid out many building blocks in order to address this issue of the pandemic from a health point of view, but also we are today discussing, or will be discussing, how the ICTs will contribute to that. I would like just to remind us that in February this year, the Head of State Summit has adopted the African Union Digital Transformation Strategy for 2020-30 that really address how transformational should be the ICTs for the African continent, and this has its major pillars related to policy and regulations, infrastructure, the innovations, and specifically the development of applications that will promote the enhancements of activities of all other socioeconomic sector, including more specifically health sector, which are actually a specific pillar dedicated to that within the digital health. With that specific approach, the ministers also in charge of ICT met and have requested the African continent and African stakeholders to strengthen the digital capacity, specifically on health and in health sector. Specifically, it's requested the African stakeholder to strengthen the digital capacity of health and national and regional diagnostic and laboratories workers. It also requested the African stakeholder to promote zero rating and or specific tariffs to access to health and education content as a critical and urgent intervention to counter the pandemic. It also requested everybody to develop and implement policy guidelines in the use of digital platforms and applications that can help trace, track, and test people who have come to contact with infected persons while balancing the health imperative and privacy concern and data protection. As you can see, then there is, as I said, a lot of building blocks, a lot of activity that has been done, but without anticipating of the content that will be provided by my colleague, Dr. Margaret, and also my colleague from the CDC and our partner from Huawei. I would like just to mention that this is one of the most important webinars, and I wish you really successful meetings here. And thank you very much.
Thank you very much, Moctar, for those opening remarks. Colleagues, once again, let me just remind you that we do have French translations, French and English translations. So if you want to switch either to English or French, just click on the interpretation tab. This meeting is also being recorded and being live streamed, so you can also follow the link or share the link to your colleagues so that they will be able to follow in real time. We also have our colleagues on the call here who are doing social media tracking. So there's also a Twitter hashtag for this meeting. And if you want to tweet something, my colleague Israel will share the hashtag quickly. So thank you, Mr. Moctar, for the opening remarks. And I think this sort of opens the discussion to the specific issues that we want to discuss in this particular webinar. And the discussions during this meeting will be structured around the following issues or aspects. First, universal healthcare access in rural areas in Africa. I think you may agree with me that most parts of Africa, or most of our populations, live in the rural areas. So this is an important discussion that we need to unpack, especially giving attention to how to ensure that all the citizens have access to universal healthcare services in light of the COVID-19 pandemic that we had this year. We also have a discussion on COVID-19 impact on health services in Africa. For this, I think it is important for us to understand how the impact of this pandemic has had on our communities, and also assess how to guarantee safety and effectiveness of medical diagnosis and other treatments for this pandemic in hard-to-reach areas or rural populations. We also have an opportunity to explore some digital solutions in the health and medical industry for this pandemic. For this, we are very privileged today to have our colleagues from Huawei to share some of the latest technologies that they've rolled out, particularly in China, and also possibly these kind of technologies can be replicated in our continent. So we want to also explore how we can exchange this kind of knowledge, how the technology transfer can happen in our continent. So to open the discussion, I will invite my colleague, King Dawit. King Dawit is the technical assistant in the Division of Health, Nutrition, Population at the African Union Commission to open up the discussion. So over to you, King Dawit.
Hi, thank you very much, and good morning, everyone. And it's great Dr. Margaret actually just joined us, and she's highly welcome. She had a bit of challenges with the link, but then it's okay now. So I will actually share my screen. If Enoch is able to share it, it's fine. If not, then I will try and share my screen so Dr. Margaret can be able to do the presentation from what I've been able to share. If that works, then we are fine.
Go ahead, you share it.
Okay, thank you, Enoch. And Dr. Margaret, welcome once again.
Thank you very much, King, and thank you for colleagues for the invitation to participate in this webinar this afternoon. I was asked to speak to policy guidelines on access to universal health care, which we had also invited WHO to provide an overall perspective on universal health care across the continent. Unfortunately, they were not able to join us this afternoon, and it is not my purview. I will not be speaking to that topic, but rather looking at digital health, universal health care through the lens of digital health and the policies that the African Union has in place. Thank you. Next slide, please. So this is rather a bit of a loaded slide, but it just gives some background to digital health and the way we see it providing a service in order to reach universal health coverage. And of course, digital health is extremely dependent on the development of IT technological platforms, including the processing of data and content across multiple platforms and devices. Why we would need digital health is to develop health systems to improve the use of computer technologies, analysis, and so on and so forth, through to which health professionals and their clients can use in order to improve access to health care. The use and scale up of digital health solutions can also revolutionize how people worldwide achieve higher standards of health and access health services to promote and protect their health and well-being. Now, this is also, next slide, please. But this is also has become increasingly important in the context of COVID, which has made us realize that accessing healthcare is no longer a static thing. It's no longer for the client to move to a fixed hospital or institution in order to address their healthcare needs, but digital health can be used to bridge the access gap. And this therefore will lead to a hybrid form of healthcare delivery, both using the static, where the client has to go to an institution, or healthcare delivery via digital health. Now, the provision of digital health provides opportunities for us to achieve our aspirations, namely aspiration 1 and 6 of a prosperous Africa based on growth and sustainable development, where our citizens have a high standard of living, quality of life, and well-being for all citizens. Of course, the aspirations of Agenda 2063 are also linked with the SDGs, all the SDGs, particularly SDG 3. And the intention is to get policymaker support, decision-making at the highest level for the provision of sustainable, safe, and ethical technology to provide digital health, for practitioners to use digital health technologies to deliver health care, and of course for the population to be able to access healthcare via digital health and all the interventions associated with it. Next, please. So we have a digital healthcare well reflected as a policy intervention within the Africa Health Strategy, which is currently running from 2016 to 2030. And the Africa Health Strategy provides health security, building the regulatory and support environment for the provision of quality medicines and digital technologies through the establishment of effective systems for disease surveillance and disaster management, efficiencies in digital health, universal health coverage, while providing measures for strong leadership and good governance amongst member states to achieve the following in particular. And the first is to strengthen capacity for sustained, integrated, coordinated, and collaborative research, innovation, and translation for digital health. And 2, to provide and implement sustainable mechanisms for investment and financing in research and innovation to improve primary health care through digital health technologies. Next, please. Third, to generate new knowledge aligned to the health goals and targets and advocate for its translation into products, services, policies, and practices to improve health, to strengthen data sharing platforms and systems to optimize digital health delivery, and to advocate for the adoption of emerging digital health technologies, supporting platforms to improve healthcare. So these 5, next slide, please. These 5 would be the reasons why we would want to advance into digital health technologies. And of course, this riding on the digital health transformation strategy for Africa, which is being led by our colleagues who I'm sure will speak to this shortly. But of course, we are very interested in the 3 reasons within the digital health strategy that will support digital health and provide the medium to ensure that digital health technologies can be available to scale up primary health care delivery and, of course, universal health care more broadly. And I'll leave this rather to the colleagues who are the experts in this field to speak about the digital transformation strategy for Africa. Next slide, please. So what would be the benefits of digital health technology across the continent? We have a list there, but 11 good reasons why digital health technology will be important for us, inclusive of the provision of accurate, up-to-date and complete information about patients at the point of care, enabling quick access to patient records for more coordinated, efficient care, securing securely sharing electronic data with patients and other practitioners, helping providers to more efficiently diagnose patients, reduce medical errors, and provide safer care, improving patient and provider interaction and communication, as well as healthcare convenience, enabling safer privacy and security of patient data and more reliable prescriptions, helping to promote legible, complete documentation and accurate, streamlined coding and billing, helping providers to improve productivity and work-life balance, enabling providers to improve efficiency to meet their business goals, reducing costs through decreased paperwork, and of course, especially during now in COVID, where everybody is running away from paper, this would be important. Improve safety, reduce duplication of testing and improved health, and finally, to facilitate the delivery of healthcare among and across and between Africa Union member states. And this particularly is increasingly becoming important when we speak about cross-border healthcare movement of transporters across borders in the light of pandemics and other health emergencies. Next, please. So what do we see as the way forward? We are already in discussions with our sister Department of Infrastructure and Energy, and we intend to develop a continental digital health strategy with its own implementation plan for consideration and adoption by AU member states. But to do this, we have developed a questionnaire to conduct a mapping in order to do a baseline assessment on the use of digital healthcare technologies across Africa in order to inform later on the digital health strategy. We need this assessment in order to have an understanding of the extent and depth of use of digital health technologies across the continent and what infrastructures are available in order to be able to scale up the use of digital health. 3, we shall develop policy guidelines, which I've already said will be approved by the policy organs. And last but not the least, we will need to engage partners and stakeholders such as yourselves in order to scale up advocacy for the use and implementation of digital health across the continent. And I would like to conclude by saying that it's increasingly relevant and more important, and that's one of the opportunities that COVID has granted us to realize that healthcare can no longer be static, i.e. the clients moving to the service, but can also be effectively and efficiently delivered for the full life cycle for all citizens by having a hybrid approach using digital health and what we are used to, as I describe as static health. So thank you very much, and I'll be available for questions later. Thank you.
Thank you very much, Doctor, for that overview, and also for making time to share with us the Africa Digital Health Strategy. I think I've picked up some interesting points there and even objectives, particularly the reasons why digital health is important for Africa. I think that was very, very, very strategic and also important for our colleagues on the call to understand that your office is actually working on something bigger that all the African countries can actually pick some ideas from. So thank you so much for that overview. And if there are any questions, I think we'll be able to address them during the course of this discussion. Moving ahead, I think let me invite my colleague, Dr. Justin Maheda, the head of division for surveillance and disease intelligence from Africa CDC, to also share his thoughts on COVID-19 impact on health services in Africa. Just a brief on Dr. Justin. He is from Tanzania and he has 10 years experience in healthcare delivery, public health program implementation, project management, epidemiology, and disease intelligence. He is currently serving as the interim head of division for the surveillance and disease intelligence at Africa CDC. So welcome, Dr. Justin, and please, the floor is yours.
Thank you very much, and appreciate for inviting us to discuss. So I'll take you from where my sister, Dr. Margaret, has ended. And as you said, we also, Africa CDC, and it sits in under the Department of Social Affairs under the Africa Union. And we implement most of the strategies that are already been given, strategy and policies that have been set by the our mother department, which is Social Affairs, and most of the things that she was discussing there, I will talk quickly on what Africa CDC is doing to start implementing them, especially on the areas related to what we call the health security, the continental African health security agenda. And to start with, I would just touch on our journey on digital solution for health security in Africa. As you may know that, and there's been given the health security, especially the health information systems and health information exchange systems are very key in supporting any program, whether it's for disease detections or implementation of programs that are related to control and prevention of diseases in the continent. And that has an overall effect and impact to the public health security or health security in the continent. But such, when you say a functional health information system, what does it entail? It entails things that are interoperable. You have interoperable digital health solutions within the continent, whereby you can allow information exchange between different solutions that are available. But systems that are supported by high fidelity technologies that allows easy transfer of information from one level to another, and also issues related to that system that allows a high quality data standards from the time of collection, processing, storage, and even retrieval. And also that's not only possible, but also enabling policies and standards to guide health information exchange within the continent. So Africa CDC, as a background, they started working on what they call health information exchange policy and standards that define this nitty-gritty of the implementation. It's more on the implementation part of the whole digital solution agenda that is also defined on the African health strategies and other documents of the AU, and as well as other standards that are known within the globe. So looking into that, the whole purpose of this is to make sure that we also set some standards and framework that guides member states on the implementation of health information exchange, and allow, if different solutions are coming to the continent, they should be abiding on those standards. And those standards from the data quality, from the security of the data that will be collected, the transmission of those data from different levels, the speed, and as well as the policies that allows, including the data sharing agreement and other related policies that provide as a background to that. So within that, also we fall into the core value and principle that will guide these policies and this exchange, which is solidarity, more of collaboration among different AU member states, issues of comprehensive needs, to ensure that we enable the continent to effectively respond to manage of public health events and other health programs, issues of transformation related to accelerating digital data sharing and development across the continent, as we know technologies is changing as fast as I don't know, it's very fast. We cannot rely on or just waiting for ensuring that we stick only or we become stagnant on the solutions that are available. We should be able to be very flexible to change as the technologies change. But now, of more important is also local ownership and ensuring that Africans institutions take part into the whole solution and the whole innovation that goes around this. And also innovations, issues related to confidentiality, and how do we prioritize on privacy and security of the data that is being collected, different level, and allow access when it's needed, and also availability as when it's really required to have availability. But also learning from latest innovations, learning from technologies that have worked elsewhere across the globe, and how do we adopt them to the continent. And this will now provide a wide range of interconnectivity and allow heterogeneous sources to be integrated to this by providing that platform that enable that. So at the end, what we're looking for is we need to have data exchange across different levels of data collection, data users, but also ensuring there's a privacy and security. And that exchange should work around the common interoperable standards that doesn't matter. So the end target of all this is that we want to have a health information exchange policy and standard that will be adopted by countries and go down to countries and support the countries to at least advance or improve their health information exchange platform and standard to achieve into this system, to achieve into these standards that have been set at the continental level. And then through that, you do a lot of advocacy, and then you go country by country and supporting them, do what they call country capacity building. So this is more of the implementation. To make sure if you are discussing of certain health information exchange security standards, you make sure you go to each country and they achieve that. If it's about the data qualities or the what they call the transmitting technologies, they're achieving certain standards. So you go to each country and support them physically to achieve these standards. And then thereafter, you have all these countries that have achieved certain standards. Now you push for a second level of data sharing agreement with AU member states, either regionally or continentally, to be able to exchange more of this critical information that is essential for maintaining the health security of the continent, especially on the public health events such as outbreaks, etc., to be able to, for countries to exchange those information at the regional level as well as the continental level. And this also has a lot to do with the legal empowerment on how countries have to ensure that they own the data, but also they share what is supposed to be shared to protect others from any public health events. And then last, when we have this now, we can create what they call interactive data analytic platforms where countries can report. But this is based on what we call incentive approach, whereby you don't just put there for countries to report and you produce reports based on what they're reporting to you, but we also create what they call a background mechanism that incentivize countries to report information, so that when they report on those platforms, the information they report bounce back to them with an added value. For instance, you have subject matter experts who provide more value into the data and analyze and give them more or generate more evidence that will make them respond better to the events, or provide them with more concrete interpretation and analytics of what they need to do and how should they view their data that they've reported into this platform. So it's a process and it will take time. Now I'm trying to give a COVID-19 user case scenario on how such technologies and maybe such what I've talked about will work. And we've started to do some few. Those, as I said, it's a long journey to arrive into that, but we're trying to use for some. So I'll talk about the different initiatives that we've been done through that. Before that though, I need to give you an update on where we with the outbreak. So far you see as we had, the outbreak has reached a peak around July. And if you see that big peak, it's more because most of these cases are also coming from one country, and it's more in the Southern African region, and South Africa was leading this. But when control was done in the Southern Africa region, cases started going down. And we'll discuss about different initiatives that have been done at this time. So, and now within the September, the cases were slightly down, but if you look around October, and again, the curve is kind of flattened, and we're still trying to see different peaks. And this will lead us to some of the solutions that we're trying to bring in to address that, to sustain the downtrending of the outbreak and the COVID-19 in the continent. And if you see, we have a lot of diversity in terms of how different countries are experiencing this outbreak. If you see, we have, like South Africa has more than 600,000 cases. And you still see some countries that have less than 5,000 cases up to now. So the outbreak has really affected different countries, and there's a lot of diversity in terms of how this outbreak has hit different African countries and the impact that is bringing into the economy, livelihood, as well as the other related issues such as movement. And this has impacted different African Union initiatives, including the Continental Free Trade area that we are trying to establish, and the free movement of people across the continent. So Africa CDT has put in different initiatives. One of them is what they call Partnership to Accelerate COVID-19 Testing. And the target was to make sure that the continent is able to detect as many cases and isolate them as fast as possible to prevent spread of the infection. And that way we can we can quickly contain the outbreak and be able to come up with a solution to be able to move back to the normal business, normal livelihood activities, etc. So within that, we had some fruits. As you see, this was launched around May, and then within June and July, when we had this big outbreak, at least expansion of accelerated testing, supported by other issues, including the tracing, etc., made it possible to quickly identify cases and contain them, and the outbreak went down, at least as we can see on the curve that I showed earlier on. But within that, also part of the solution to make sure that those medical supplies, especially the testing kits, are done, we also launched what they call Africa Medical Supply Platform. That has helped member states also be able to connect with different suppliers and negotiate and get the supplies for the testing kits and other supplies that they needed to respond to the COVID-19 response with preciseness. Also, now, the outbreak is going down, but also we need to strike a balance between saving lives by preventing infections, but also saving economies and livelihood. We also embarking on a campaign, we call it African Against COVID-19, Saving Lives, Economies and Livelihood campaign, which is trying to ensure that we're protecting the infection, but also protecting the borders and travel, so we can allow people to still move without, but through limiting infection spread as people are moving from borders to from country to country or within the countries themselves, but also preventing or protecting the economies and the businesses, whereby this is where people are getting their daily ends as well as putting foods on the table, but also protecting the livelihood and other activities like schools, allowing kids to go to schools and learn, and we don't paralyze all other systems. So one of the solutions, and this is also the user scenario, it's also we launched and rolled out what they call Trusted Travel Portal that allows a free exchange of information from when you're moving from one country to another to show that there's harmonization in terms of pre-entry and exit requirement, creating the trust on the tests that are being conducted from one country and how it can be accepted and being trusted to when you're moving from one vicinity to another vicinity. So also ensuring that when you move across, even before you move, you understand what is required from your side, and also how you can access some of the information that you need to fill, including the health status report from the place where you're going, and you get prepared. So this is a digital solution. Instead of you going and moving to an office, and then you can get it at your hand, and you can have all this information, even identifying where you can get a test on where you, based on where you're coming from, and the test that will be trusted as you move from where you are, your point of location, and to the destination point. So these are the key scenarios that we've shown and have demonstrated how technologies can be used to respond to such. And they are trying to also build upon big pictures of arriving to where we want to be and the digital solution for public health security in the continent, the health security in the continent. Thank you very much, and over to you.
Thank you very much, Dr. Justin, for that presentation. I think it showed some great insights on how technology can actually help address some, how digital health can actually help address some of the issues that or challenges that we are seeing in managing COVID-19. So thank you for that. And there could be some questions for you in the Q&A, but let me first give my colleague from Huawei an opportunity to share some insights on the latest technologies and maybe digital solutions on how to leverage in the fight against the pandemic. So next, let me invite Mr. Yang Chen. He is the Director of Public Relations and Government Affairs for Southern Africa with Huawei, and to give us a presentation on how digital solutions in health and medical industry for addressing the COVID-19 pandemic that we have just started talking about. Over to you, Mr. Yang.
Thank you very much. A pleasure to have the chance to share our experience on how can ICT plays a critical role in the fight against the pandemic. And now I will share my screen. Just a moment, I'm sorry. It's okay now? Can you see the screen?
Yes.
Okay, thank you much, thank you much. And now I will I'll begin. And my topic is staying together and fighting the COVID-19 together. I would like to introduce some of our experience and expertise in how can the ICT and how can Huawei do in fight against the COVID-19. As we all know, the current COVID-19 global risk and pandemic is reality that no one can escape from. And the impact because of the out of control spreading, the high risk and the silent, all this feature of this pandemic, the impact COVID-19 has had on jobs, education, economies, and lives have been classified from disruptive to devastating. Human nature is to keep fighting, and with implementation of ICT solutions, we have a better fighting chance, and we can save. I think we can save more lives. Okay, and then next, relating to the prevention and control of the COVID-19, there are two key points to consider, I think. The first one is external input, and the next is internal spreading. In the traditional areas of congregation of people are high risk and allows the virus to spread unchecked. Once people are infected, detection, isolation, and treatment is of critical importance. Early detection and isolation mechanics, I think it can decrease the spread significantly. But the question is, how do we do it quick and efficiently? ICT solutions, as we shall see, provides the platforms and the mechanisms to do it. Right from the onset of the COVID-19 pandemic, ICT with its associated solutions have been critical in managing and mitigating the virus, which ultimately translates into saving countless lives. China serves as an example in adopting various ICT solutions in fighting the virus. ICT helps in each of the health verticals to discover, detect, isolate, and treat during the pandemic. Who is affected? Who have the affected people been in contact with, and what mechanism of isolation should be considered? How can we treat them effectively? Even while they are in isolation, how do we manage the risk of contamination between the patients and the medical respondents? In all of these areas, ICT can play an important part. ICT solutions allows not only for healthcare, but also provide a platform for other verticals to be incorporated, and later stage or with adopting approach that will bring value to other critical stakeholders. Public safety, government, communities, and educations as a few examples. Sorry, can all benefit from ICT investments from the efficiently. From efficiently actually capturing the data and to processing and evaluating the data, and finally the application to obtain the maximum benefit in fighting the pandemic. ICT remains just a platform, and also the solutions remain critical. And next, in order to remove the associated risk of infection and contamination, ICT solutions could be adopted in various forms, as shown in the picture. Here we have examples that showcase some solutions associated with remote collaboration, remote diagnosis and protection, and remote training is another key component that could be implemented to reduce the spread of the disease. And many countries who are in lockdown and where movement is restricted and are adopting this solution, and thereby to ensure business continuity. ICT enable ambulances, allow patient real-time data and diagnostics to be transmitted to the receiving hospital. Thus, when the patient arrives, the medical response staff is already familiar with the condition of the patient and can act immediately. The most popular application, mobile trolley, allows patients to engage with doctors and staff, even dispensing medicine to them, and to no risk of exposure, since all communications is done via the screens and robots. In remote areas, mobile detection vehicle is utilized, and those in far-reaching areas can be served efficiently. In areas where contamination is found, unmanned vehicles can be utilized to fumigate and spray the areas, again with no risk of human operators. I think we need to be clear that each of these solutions would not have been possible without the underlying ICT platforms and connectivity. It is important to note that each solution's technical requirements need to be considered and implemented accordingly. And the next is the internet hospital solution. Long queues with extended waiting periods, efficient personal information capture methods, poor or missing patient records could all be the thing of the past when ICT online solutions are adopted and implemented. The benefits of ICT platforms extend beyond the before to the entire treatment process, and even after patients have been released. Availability to and accuracy of information is critical in fighting the pandemic and in saving lives. AI has been used in this war to the pandemic. AI as examples has been extremely successful in improving diagnosis times and accuracy. This case shows us the AI identification can be up to 6 times quicker when applied, and ultimately allows the doctor to react quicker and save lives. And gene sequencing reveals secrets of virus 10 times faster. With the adoption of ICT, we encounter vast improvements in even very complex processes such as the gene sequencing. Improvements of 10 times the norm have been experienced once we allow the technology to take over and do what it does best. Ultimately, this translates into improved efficiency, less mistakes, and more lives that are saved. Huawei and Wuhan Telecom built a 5G remote consultation platform of Xiehe Hospital within 1.5 days. It's very quickly. It's connected to the main hospital of Wuhan Xiehe Hospital, the West Hospital, Beijing Xiehe Hospital, and Beijing Chaoyang Hospital, and the Xiehe Cancer Hospital. The smart screen display, high definition intelligent conference terminal, and Huawei Cloud quickly realized the remote command and the remote consultation functions of the epidemic. In the current situation, the solution helped with the medicine and the treatment, reducing direct contact between the doctors and the patients. I think, and finally, we prepared some key takeaways. I think we have all seen that the ICT technology can play such a critical role in the fighting to the pandemic. I think Huawei, as a trusted advisor, is always available to partner with assisted stakeholders as required. And we believe we have the expertise and experience to make this happen in any country. So that's all my presentation. Thank you very much. And next, thank you very much. Thank you.
Thank you very much, Mr. Chen, for that presentation. Very interesting, and I think from your presentation we have seen the many opportunities that are presented by ICT in the health sector, from the use of robots, non-human operators, to even sharing data platforms. But I think what is also central to the issues that you have shared is the access and the connectivity issues, which are very important and central to the success of such solutions. And I think this is an important issue that speaks for Africa. So before we open the floor to questions and interactions from our audience, I think let's have an opportunity to tour, to visual. We have a virtual tour, a presentation from Huawei, which I think is going to be very interesting for our participants. And please join me in this virtual tour and enjoy. Over to you, Huawei. I'm not sure who's
yes.
presenting. Okay, great.
Okay, thank you. Yeah, good morning, dear all friends online. Yeah, my name is Jackie Zhang. I'm from Huawei Shenzhen headquarters. So it's my pleasure to give you a live presentation. Yeah, to show the E-Square Exhibition Center. Okay, I'm from Telco Business Group. Yeah, I'm more focused on the solution and marketing. So today, through this E-Square Exhibition Center, I would like to share some stories and experience about how ICT technology create value for all of us, for our community and for our society, especially in this very special time. We are facing the challenges of the pandemic. So I will give you a tour, with around 6 stands. Let's go through it one by one. Yeah, the first stand. Yeah, I would like to say that the pandemic have give a lot of the changes to our lives. More and more people has moved from their activity from offline to online, no matter for the working, education, or even business. So it's very important for us nowadays that the digital infrastructure is very important. And I would like to share 3 scenarios from you. Yeah, the first one is the digital life. I will more focus on the healthcare. And the second one, I would like to talk about some stories about the how the ICT technology help the SME to participate in the digital economy. And the third one, I would like to share you some cases regarding the digital governance, especially for the government and for the enterprise. First of all, I will go to the smart healthcare scenario. Yeah, as we all know that the ICT infrastructure, especially 5G, 4G, or fiber, has played a very important role in the fight with the pandemic. No matter for the smart healthcare, we're talking about the remote consultancy or remote treatment or the public prevention of the COVID-19. So here I give you 3 small cases. Yeah, the first one on my right hand is actually the mobile trolley, which my colleague, Mr. Yang, has just mentioned. Yeah, this is a very small application, very small tool, but it's very useful. Yeah, this mobile trolley, with this mobile trolley, the nurses can push the mobile trolley to the ward or to the ICU room, which means that the doctors can do the checking with the patient from the remotely. He don't need to go on site every day for twice every day. So this can save a lot of time of the doctor resources. So through this mobile trolley, you can see that on this screen, the doctor at the remote side can see all the medical informations Yeah, especially, for example, for the vital sign information from such kind of equipment. Okay, and then it can also talk with the patient through the camera, IPC camera. So this is very widely used, yeah, in China and especially in some other countries. The second one I would like to share is more story is about the remote B ultrasound. Actually, during the pandemic, we have one doctor actually helped the doctors in the Wuhan city from 700 kilometers away to do the B ultrasound, because the B ultrasound we required very sophisticated doctors to do this job. So we are lack of the doctor resources, and at that time we can do it remotely using the very experienced doctors from the other cities. And this has been used in the Beijing, Shanghai, Guangzhou, and the many other cities. They are connected through the ICT connectivity. Yeah, the third story I would like to share is the medical care robot. As we all know that in the in the hospitals, we are a lot of heavy work for the health workers. With this robot, we can reduce the workload for the nurses, for the doctors. The robot can deliver medicine or very necessary material to the patients. And of course, this kind of robots, they have a lot of varieties. For example, this kind of robot can do the disinfection and also can be using in our communities. Yeah, for example, the unmanned vehicles to deliver necessary food in to the apartment or for the houses. And for my experience, when I come back from Europe in the March this year, I was living in a Huawei hotel, and I forgot my room key. They actually send this kind of robot to deliver the room key to me, and I don't need to go to the reception to take the room card. Okay, let's move to the next stand. As we all know that it is very important for the applications to support us, but the underlying is that we need to have the connectivity and the cloud platform. Yeah, this on my right hand, you can see that this is the base station. This is actually a 5G base station. It's very small and compact design, and actually with this kind of advanced technology, only one man can carry this base station to the rooftop to finish the installation. And in China, in Malaysia, we actually help the local telcos to deliver the 4G and 5G connectivity just in 3 days to bring all the connectivity online. And for the cloud, as we all know, all the applications, we need to run on some kind of platform, okay, especially when we talk about the AI or any kind of software. And for hospitals, actually, they don't have their own ICT platform, I mean the cloud platform. So in these cases, what could they do? It's not possible for every hospital to build their own cloud. They can actually share one cloud deployed by local telcos, for example, and then they can share the applications. So it's very important to bring the connectivity and cloud together. Yeah, for the next stand here, I would like to share is that, yeah, as we all know that many countries have started to recovering their economy after the pandemic. Of course, the SMEs is very important. And as we said, that they need to participate in the digital economy, okay? And actually, the SMEs need to get used to do the business online, but they need the connectivity as well. So in the traditional way, we usually need to deploy the copper or fiber to provide the connectivity for SMEs, but it takes time. It probably takes the relatively high cost for them. So with this, Huawei's innovative solution, we can provide the connectivity to the SMEs through the wireless solution. For example, here is a very common equipment. You can see that this is a router and it's very quite similar with the traditional one. But the different thing is that with this kind of the traditional equipment, we bring our 5G communication modules inside. That means that we can easily, quickly to deploy the connectivity for the SMEs, in very short time. And after that, if they really need the fiber connectivity, and then we can using the fiber. But at the very first time, we can provide connectivity through 5G or 4G. Okay. And let's move to next stand. I would like to share about some stories about the digital governance. Actually, here I have 3 stories, especially at this time when people starting go from the lockdown time to go out to work, and usually they need to make sure everyone feels safe, and government need to have or enterprise need to have a very efficient and digital way to do the management, to create very safe or very manageable environment for the people who has recovered from the lockdown. The first story I would like to share is the health code. Actually, this is a very small application, and let me show you the case. I will open WeChat. It's a very common social application we have used in China, and we just scan the QR code, and it will show that in the past 2 weeks, which cities I have been. If I have a green sign, that means I'm safe, and I have never been to the very severe impacted places with the pandemic or the COVID-19 infection area. So this has been deployed in almost every airport, train station, hospital, or many public places, in China. And we also seen that these similar applications are under deploying now in in East Asia countries, for example, South Korea, in Thailand. They have their different ways to deploy such kind of the approach to support the government or the enterprise or community to do the digital management. The second one is I would like to talk about the mobile payment. For example, if mobile payment platform has been very important for us now, especially in many countries. If we have this payment, for example, when we do the parking, we are not going to go to the insert the credit card or anything or pay the cash. We just scan a QR code and then we finish the payment. That means we will reduce the contact between the people. Okay, and the third story I would like to share is the infrared body temperature measurement. It's very simple, but already widely used in many places, across the world. And we will see that we either use the fixed camera, we can also use the mobile robot to do the group body temperature measurement. We can see that from this video, we have the fixed cameras, and we will see the mobile robot to do the body temperature measurement. So it's very important for us to do this kind of digital approaches. Okay, let's move to the next stand. This is the last but not the least one, is I would like to share how, since the ICT infrastructure is so important for us, so many countries, governments have issued very positive policies to support us, to support the local telcos or ICT infrastructure providers to roll out their network. For example, in China, China government has issued a new infrastructure strategy, which has included 7 domains. 5G, AI, data center, and industrial internet are digital ones. These are the many years policy, and it is related to hundreds of billion US dollar level investments. And another case is in South Korea. We will see that they have taken 4G and 5G as the very important strategy, because this not only provide connectivity for the people to support but also to support the economy recovery, especially for the 5G. You can see that in the first half of this year, they have doubled their 5G investment, and also they have finished their coverage of their 5G for the metro. 50% of the metro has been covered by 5G is very amazing and very impressive. Okay, and of course we have seen that in South Africa and some other European countries, they also have the issued solutions and policy strategies to enhance the capability of the ICT infrastructure. So all of my presentation here, I would like to share is that we are seeing more and more important for the digital approaches to help us to do the digital governance and to support us to do the economy recovery. So Huawei as the technology solution provider will continue to do the investment and provide technology for the people and for our society. Okay, thank you for all your time, and again, it's my honor to present this to do this presentation.
Thank you very much, Huawei, for that visual tour. Very exciting and very interesting. We do have a phrase in Africa, an African phrase that says, seeing is believing. So I hope that the participants and also some of my colleagues have seen what opportunities are there in the digital health solutions, applications and systems that you have presented. So I think this virtual tour sort of makes it much more easier to comprehend the issues that we have been discussing and some of the solutions that have been shared. So thank you very much for that tour, and I hope that it was interesting for everyone as it did to me. At this point in time, I think I would open up the discussion to the floor so that we get to interact with the rest of the participants. So please, if you have any specific questions, please post them in the Q&A. So far, I've seen one interesting question that possibly might go to my colleagues at the African Union Commission as well as Africa CDC. So there's one question from, just one moment, from Herman Ramos. And I think the question has to do with, it's a bit long, but I'll quickly summarize. I'll try to summarize this question. So Ramos says, the lack of digital cooperation between some countries is quite evident, and I think I agree with him. This is something that we see all the time. So how can African Union Commission engage with all countries and organizations to strengthen this digital cooperation for a better health service in the medical industry? So he also mentions that we're seeing some challenges in African countries ratifying the Malabo Convention as a particular example. So are there any efforts from our colleagues at the African Union Commission to make sure that countries are able to use these recommendations that the African Union Commission is finding out? So maybe I'll give Moctar, Dr. Margaret, and then last Dr. Justin an opportunity to share some thoughts on this question. Moctar first.
Thank you, Verengai. Although I wasn't a panelist, but that's fine. Since the Malabo Convention has been mentioned, that I feel really then interpreted, if I may say. Now, the issue of digital cooperation is actually not a problem only in Africa, it's all around the world. You may recall that the UN Secretary General report 2 years ago, following his creation of what we call the Digital Cooperation Task Force, have mentioned the report that there should be more cooperation between the digital different sectors, specifically when it comes to the policy and the regulation, because we cannot allow ourselves anymore to really do regulations and policing in the digital context in silo. So, but from the African Union point of view, we tend to really promote and advocate this digital cooperation in different areas. First of all, by having that milestone on the digital transformation strategy, which is actually the baseline for anything to be done with regard to the digitalizations and digital transformation. And second, and more specifically with regard to the issue related to the cybersecurity, electronic transaction, and personal data protection, the Malabo Convention has been set up, and as the participant has mentioned, yet to be really ratified. We still four ratification to go in order to make it really entering into force. But we are pushing for that, and the not only we have created an African Union advisory cybersecurity advisory group that is promoting, but had it been the COVID-19 this year, we would have really implemented our plan in terms of having this Malabo Convention ratified. Over to you.
Thank you, Moctar, for that for that response. Dr. Margaret, do you have any thoughts on how we can build digital cooperation amongst our nations, especially in the EO sector?
Yeah, I think my colleague Moctar has sort of framed it, and this is one of the reasons why we are doing the mapping exercise. It will be the beginning of process of bringing member states on board around the entire issue of digital health and digital technologies. We know that there is some progress out there within some member states, but not all. And what we would seek to do as a commission is to build consensus as to what the continent should be doing, what should be the policy framework to advance digital health across the continent, given that it is going to rely heavily on collaboration and cooperation between member states and amongst member states. So the mapping exercise will be the first step to understand what member states' position is on this, what systems are available within their countries, and then we can take it from there and go through our policy organs and systems in order to bring member states around the issue, bring that collaboration and cooperation that is so needed.
Thank you, Doctor. Justin, do you have any additions on this, or?
It's a quick one. I think Africa CDT is more of an implementing agency or institution of the AU, and we're trying to go on ground and implement, like doing practical implementation on most of these conventions, guiding policy and strategies like the African health strategies. But our main focus is on ensuring the continental health security to allow most of these initiatives that are given by the Africa Union, such as free movement of people, continental free trade areas, to operate without being jeopardized by the risk of having big public health events within the continent. So as I presented earlier, also we are picking some of these conventions and strategies that are already there into the actual implementation, and we are now pushing towards the actual implementation, especially in the area of health security. And that's why we have trying to define on the practical terms on what does it mean by standards of information. How do we put a facilitation to exchange information from one country and others utilizing the available digital solution. And I think I'll join with the question that has been posted on the chat with Kwasi about how to use just one e-health solution for the African people. So looking on the exchange of public health events, having those exchange platform for public health events, it's very difficult to make sure that we have one e-health solution for the whole continent. But at least if you can allow or create a backbone that allows the interoperability between different solutions by ensuring that there's a minimum IT standards, there's a minimum data quality standard, there's a minimum security standards, etc., that will allow interoperability between different systems, that's okay, because we know most of these systems are owned by different service providers. So you cannot force for one system, and then the very diverse political organization or political continent with 55 different member states with the different autonomies and jurisdiction. It's difficult, and because you're also promoting, as I showed, that we need to promote for African solutions. Most of these African countries may also come with their own internal solutions to such. The key issue is interoperability. How do we allow such interoperabilities within different countries? And this is where we're trying to make sure that these standards are given. We go to each member state giving a practical support to be able to achieve those standards and allow that interoperability to happen. I think if we make that step, that's okay. It's a very big step in the continent. And then now we work on the other policy-related issues in data sharing agreement, especially on the critical information that is essential for ensuring the health security of the continent. So for me, my thinking is just having that environment for interoperability rather than one solution that is applied to the whole continent. Thank you.
Thank you, Justin. And speaking of data sharing, I think there is another interesting question. And I think this can also go to Huawei. The question is asking on the safeguards that are there in terms of, you know, the privacy of individuals. So from the presentation that we have seen, I think we have seen that a lot of data is collected about the individuals, and are there mechanisms or safeguards to make sure that the privacy of individuals is secured? People are confident enough to know that once the data has been collected using all these tools that we've discussed, it will not be abused, it will not be shared anyway, or, you know, outside the scope. So maybe I'll invite my colleague from Huawei to share some experiences from China, and also if you have any other thoughts on how we can secure the privacy of individuals and in the process of data collection.
Yeah, this is the Jackie from Shenzhen. Yeah, there's some cases I just share. Of course, we need to follow the policy issues in each country, in every country. So especially if we are talk about, for example, for the infrared body temperature measurement, I think this has been set in many public places. And all this information I would like to share is that they don't save this kind of the images, for example, at the airport. Okay, usually the government, yeah, of course, they will not save this kind of pictures of the individuals. Yeah, and especially, yeah, and for the travel, I mean, for the travel for record for the past 14 days, this has been legal in China. I mean, we follow the government's policy, and this actually services has been provided by the local telcos. Of course, you probably need to sign some kind of agreement that I agree to use this kind of application. So I would say, yeah, especially for example, for GDPR in Europe, yeah, all these apps must follow the policies and rules. Okay, in Africa, the same. I mean, every country should try to minimize the risk of this kind of application. Yeah, for the private data protection.
Thank you so much for that response. I see there's one more, in fact, two more questions, and probably these will be the last questions before we close. I see we are just 2 minutes before the end of this meeting. One interesting question that I think goes to CDC and AU is, how are you encouraging startups or entrepreneurs in efforts to embrace tech in public health emergency? Is there a program that the young entrepreneurs can tap into? Are there resources and stuff like that to encourage young Africans to take up these opportunities and challenges and develop applications that can apply for us?
Let me try to answer. Unfortunately, there is no really a specific program dedicated to kind of support, be it, and I'm see what they are alluding to, financial support most of the time, which is actually the thing that is lacking too much. 3 years ago, we have created a forum for the startups, African startups, and then we connect them through our partnership with the European Union to see how the startup from both sides can really cooperate and work with them. However, the Smart Africa Alliance is also having more proactive program in supporting the entrepreneurships and specifically the startups. They have created what we call the Startup Manifesto, and that help most of to guide startups to really tap into to develop their business and their applications. The only challenge we still have really is the issue of funding. Now, we have to be more creative. The issue of crowdfunding and the software collaboration is something probably most of the startups need to consider, given the fact that there is a lot of resources so far available. Then the only thing we have to try now is to be creative in going to the crowdfunding and make sure also that we are using the opportunity provided by digital platforms to do so-called the software collaborations and development in a collaboration way. Over to you.
Thank you very much, Moctar, for that. Do we have anyone else who wants to chip in, Justin or Dr. Margaret, on this question, and then we can round up the discussion?
I think my colleague Moctar just captured very well. As Africa CDC, we also depend on other AU departments, including the Human Resources, Science and Technology, and others to capture the other supportive part of it, like technological driven initiatives, and we engage them when it's necessary to apply in terms of how do we look for solution and in the health related issues. And I think he captured everything, so I don't have more additional inputs into this.
Thank you very much. And I think at this point in time, I think we need to close this discussion, but this was really an exciting and interesting discussion, something that we have been out of the scope of the webinar series that we had. In the past, it was mostly focused on the internet and access issues, but I think this particular one is quite interesting and relevant because it touches on a particular issue, a particular important issue where ICT or digital solutions can actually provide unique solutions. And COVID-19, I think we all agree that it brought some challenges that were not anticipated by anyone, and these solutions are worth considering. So thank you very much to all our participants for making time to follow this webinar and discussions. Particular thanks to our partners, Huawei, for providing some exciting and interesting solutions that are happening, that are being implemented in China and probably across the world. So once again, let me say thank you to the team that was behind the scenes. There's the ISOC team, the African Union Commission team that is working behind the scenes to make sure that this webinar was a success. Many thanks again to the panelists, Dr. Margaret, Dr. Justin, King David, Yang Chen, and the colleagues who led the virtual tour, as well as Moctar. Moctar, I know you have been very instrumental in making sure that these webinars, we consistently have them so that we unpack all the important issues that are also important for Africa. So once again, colleagues, thank you very much. We'll make sure that all the discussions that needs to continue after this webinar continues online. On email, we will also share the reports and the presentations for those that may have an interest to follow these discussions outside of this webinar. So thank you once again and have a good day. I think we may stop for now.